eyelid sebaceous gland carcinoma. These sebaceous gland carcinomas are most common eyelid malignancies, and they arises from the meibomian glands, glands of Zeiss, glands associated with the caruncle. Most common site being the upper eyelid, and they are known for their multifocal origin and pagetoid spread. Different presentations include solitary eyelid nodule, diffuse eyelid thickening with loss of lashes, chronic blepharoconjunctivitis, and rarely they can be pedunculated or ulcerated. Histopathology is the diagnostic modality of choice. In indicated cases, we do imaging to rule out distant metastasis. The purpose of our study is to evaluate the outcome of primary surgical treatment in terms of cosmetic, that including the lid contour, lid malposition that is occurring after the surgical treatment. But these problems, these issues sometimes also have functional issues. Now, the secondary is the functional. By the term functional, I mean that these are more serious and more long-term implications, like local lid recurrences, local lymph node enlargement, distant metastasis, death due to metastasis. We also study different intraoperative and postoperative complications. It is a single center, single surgeon studied in a tertiary eye care center in eastern India. Ethics committee clearance was taken. The cases were collected from the MRD department over a period of 6 years. An incision map or excision biopsy proven cases of eyelid sebaceous gland carcinomas undergoing primary surgical intervention were included in the series. Presence of pre-existing lymphadenopathy or any evidence of distant metastasis or any history of prior chemotherapy or radiotherapy were excluded from the study. Thorough clinical examination was performed. Thorough examination of the tumor mass regarding its site, size, laterality, and the character, along with the systemic examination was done. The complete preoperative investigations to rule out metastasis like liver function test, chest X-ray, USG, whole abdomen, and in indicated cases, CT scan, MRI, and preferably nowadays whole body PET scan is performed. These are the different clinical appearances, starting from a small solitary nodule to ulcerated growth to diffuse eyelid involvement. Now, the tumors localized to eyelid were handled with wide local excision with margin clearance, preferably under frozen section, and confirmed by permanent section. In few cases, incision biopsy was done before local excision. Different methods of lid reconstructions were adopted. But diffuse conjunctival involvement or tumors with orbital spread were handled with orbital exenterations. Total 102 eyes were considered, and age range was 50 to 70 years, and female preponderance. Orbital spread was seen in 2 cases, and histopathology reported showed margin clearance in all 100% cases. Most common tumor was in tumor stage 1B, that was according to AJCC edition of tumor staging. And the perineural or perivascular spread was seen in 30 eyes. Histologically, 2 cases showed extensive pagetoid involvement, and minimum follow-up period was 6 months and maximum was 5 years. Now, according to the number of eyes and the tumor size, it is seen that tumors less than 10 mm was most common, about 95 cases, and clinical subtypes, the nodular variant was most common, around 73.56% of the cases. Now, if we consider again the distribution of the different clinical pattern with the tumor size, we get it nodular variant with tumor size less than 10 mm was very common. Methods of surgical intervention included, the most common was a direct closure. 56.86% cases we could manage with the direct closure, and next was the direct closure with little tissue release by doing cathedomic antholysis, 20 cases. The least method this chosen was master cheek rotation flap, only 2 cases, and the most devastating or destructive surgery that was performed was on 4 cases. 2 cases with pagetoid spread and 2 cases with orbital spread. In this distribution pattern, again we can see the master's cheek rotation flap, how it was done. This is a patient with Cutler beard flap. This was one patient with post-exenteration. Now, postoperative complications were 48 events in 32 eyes, most common being the scarring. Now, in order to assess the outcome, my statistician had to calculate me the weighted failure rate, which was more 170% in larger tumor, more than 20 mm. So overall success of the procedure rests on the short-term risk minimization as well as the long-term durability of the process, and for smaller tumor size showed the long-term effectiveness of the procedure. To conclude, the surgical treatment for the eyelid sebaceous gland carcinomas is very effective. Large tumor sizes have more chance of treatment failures. However, sample size and in the later subgroup was small, so this interpretation could be fallacious also. Thanks, and these are my references.
So